Welcome, and in this video we want to think about what's going to happen for the rest of 2020 and indeed into 2021. And this of course is going to largely depend on where you live. The pandemic is going to carry on unfolding different countries, different areas of countries at different rates. But let's look at the situation in the UK to start off with, and partly in the US. And we'll see if we can get some sort of feel for this, some sort of principles that can help to inform how we work out what is going to happen over the next month. Now, this is Sir Patrick Vallance, who's the UK's chief scientific advisor. And this is in quite a few news outlets. COVID-19 will probably be a long-term feature of people's lives. Now, don't really like the sound of that. What does long term mean? I guess what we can say at least is Sir Patrick is not thinking this is going to go away in weeks or months. It's going to be here for the rest of the year, into next year, and possibly beyond that. Personally, I think we're going to get rid of it eventually, but it could take some time. And there you see I've been about as precise as Sir Patrick. We're not looking in short-term things here. Sir Patrick Vallance again. There's a very high likelihood that come winter we will see an increase in cases. Now, I've really thought this all the way through. In winter, people close the doors, they have less ventilation, they huddle together for warmth. More activities are indoor. Less vitamin D is produced by the skin, and the circulation to the nose might be affected by the cold weather. And we know that every winter there's an influenza increase. We always have a flu season. And Sir Patrick is saying that it's probably going to be the same with the COVID-19. There's going to be an increase in cases come winter. And I feel that this is the case for the United States and for the UK, and indeed for the rest of Europe. A bit harder to say about other areas of the world, but I would believe that's going to be the case for these areas. So basically in the English-speaking countries, and of course in the Antipodes it's the other way around, it's their winter now, of course. Sir Patrick again, and I think it's quite probable we will see this virus coming back in different waves over a number of years. So he's sort of focusing down on his long term now. He's talking about a number of years. Does he mean 3, 4? Who knows? So a number of years we could be getting waves of COVID-19 infection, unfortunately. A number of years. A fresh spike in cases later this year would still be part of the first wave. Now, it's interesting that he said that, because I've actually thought this myself a few times. What we're seeing now is not really a second wave. It's just a continuation of the first wave. A second wave is a more distinct feature, maybe happening after a substantial die down in the amount of infections, then a big increase. Whereas what we've seen so far in the UK, at least, and in other places, it's just bumbling along. We haven't got rid of it altogether. It's still sort of carrying on a bit. So really, this is just a funny shaped first wave that we're in now. We are still in the first wave. The increases at the moment aren't really a second wave. Still part of the first wave. So a fresh spike in cases later this year would still be part of the first wave. So we're in the first wave now, and the spike that we're probably going to get in winter is still part of the first wave, really. And then Sir Patrick again, all we've done is suppress the first wave. And when you take the brakes off, you would expect it to come back. So the reason that we're having less cases now is because of the lockdown measures that we have implemented, because of the infection control measures we've implemented, because of the hand hygiene, because of the social distancing, because of the mask wearing. All of those things have brought the transmission rate down and therefore the infection rate down, which of course is very encouraging. But if we relax these measures, if we take the brakes off, then the cases will just increase, because it's still spreading, albeit at a lower rate. The R value is, we believe, well below 1 in the UK, but it's still there, it's still spreading, and it's still in the community. So all we've got to do is take the brakes off, and we will see a resurgence. We will see this virus coming back. We are still at the beginning of this pandemic. We are still at the beginning, because we are nowhere near herd immunity. And as we'll see, we're not quite near a vaccine yet either. So take the brakes off. We expect it to come back, unfortunately. So that's Sir Patrick Vallance, Chief Scientific Officer. Now if we go on to Chris Whitty, the Chief Medical Officer, the virus is expected to circulate winter into next spring. So he's saying the winter of 2021 up to the spring of 21. He's not saying it's going to stop then. It'd be nice if it did. But he's saying it's going to carry on circulating over the next 9 months, essentially. Now, Professor Jonathan Van Tam is England's Deputy Chief Medical Officer. So he's one pay grade under Chris Whitty. And he says this. The reality is, until we get a vaccine, and only if we get a vaccine that is really capable of suppressing disease levels, will we ever be out of this. So this is, again, it's a bit depressing, this really, but this is what these senior doctors and scientists are saying. So what Jonathan Van Tam is saying is that the vaccine needs to be a good one that gives a large amount of immunity to most of the population, and only then will things be completely back to normal. Until then, things will not be quite back to normal. So what he's actually saying here as well, that if we don't get the vaccine, then the natural immunity, the herd immunity that is going to be developed in the community, is not going to be enough to eradicate the virus. It can still come back in smaller waves, as Sir Patrick has said, potentially over several years. So basically, we're waiting to see how effective the vaccine is going to be to get us out of this. Otherwise, it's going to be trickling on for some time, unfortunately. From that perspective, we may have to live and learn to live with this virus in the long term. Certainly for months to come, if not years. So if a brilliant vaccine comes, say spring 2021, summer 2021, and there's a good uptake, then that could eradicate the disease. It's the vaccine we need to get us out of this. Now, I get criticised for saying, we're waiting for a vaccine, but the reason I'm saying we're waiting for a vaccine is because we're waiting for a vaccine. Which, of course, we are waiting for a vaccine. Centre for Disease Control in the United States, the boss of that, Robert Redfield, he's saying that fall and winter, this autumn and winter, will be one of the most difficult times we have experienced. So, Director of the Centre for Disease Control says that there's difficult times ahead this fall and this winter. So we see the cases greatly increasing now, and it's still only July. So August, September, October, the cases could still be increasing. And then we can have all the complications associated with these cases over winter. So the Robert Redfield's prediction here seems to be that the peak of this is not going to be till autumn and winter. We've got a few months to go of high levels of cases, because he thinks autumn and winter are going to be the worst times. We are still at the start of this, unfortunately. And a few days ago, we did a very full report, do look back, from the Academy of Medical Sciences in the UK. That's the reference there. Do look at that. It's a straightforward read. It's not in scientific gobbledygook. You can understand it very readily. Prepare for an R0 of 1.7 from September without mitigation measures. Potentially an R0 of 1.7. That means exponential rise in the winter months, giving us a peak in the UK potentially round about December, January, this next winter, consistent with what Robert Redfield fears for the States. I also fear for the UK. The UK could have 120,000 deaths unless mitigation strategies are put into place. And of course, they will be put into place. So I wouldn't expect it to be that high, but we can still guarantee more deaths for the rest of 2020 and into the winter months of 2021, unfortunately. I hope I'm wrong. Don't see why I am, though. Now, the vaccine story. Now, the Oxford vaccine, Oxford's AstraZeneca, I think it is, isn't it? That's doing fairly well. So the Oxford AstraZeneca trials vaccine is under large-scale trials now. Not yet phase 3 trials, just phase 2 trials, experimenting on large numbers of people. What do you call that one? The Imperial College London one. That is, I think they're planning on testing their vaccine on about 100 people in the next few weeks. So they're at an earlier stage. But Dr. Fauci is quite bullish about the American vaccine. Now, this is the Moderna National Institute of Allergy and Infectious Diseases vaccine. Now, of course, Dr. Fauci is the big cheese of this National Institute of Allergy and Infectious Diseases. He's director of that, isn't he? So, but he seems to be optimistic. Now, I suspect he's right, but in fact, I'm sure he's right. No doubt I'm sure he wouldn't be lying to us. But people that are developing vaccines need a lot of research money. And if they were to say, oh, well, this is all rubbish, then the research money might not come. So in a sense, people have to be upbeat about it because that's how you get the funding. It's like NASA's always talking about life on Mars, you know. I mean, it's, if NASA said, look, the possibility of life on Mars is virtually zero, then people would tend not to fund missions to Mars. The chances of life on Mars are virtually zero. But if you say that, you're not going to get the funding. So you've got to be kind of upbeat about it to get the funding. But having said that, he's optimistic. So I'm happy to take his word for it. He's not going to lie through his teeth about it. I believe that it's what he believes. But there again, he has to sort of support the home team, and that this is his baby. Vaccine appeared to offer the type of protection seen in natural infection. So Dr. Fauci again. So what he's saying here is when you have a natural viral infection, then you're going to develop immunity to that infection. You're going to develop antibodies, the immunoglobulins, and you're also going to develop memory T cells that recognize that particular type of infection. And there's other immunological responses take place as well. And of course, when someone's had a disease, a viral disease, then they make their own immunity to that. Then they have a very good level of immunity to that disease. And typically, the level of immunity that someone enjoys after they've had the disease is better than the level of immunity someone enjoys after they've been vaccinated. So what Dr. Fauci is saying here is his reason for optimism, and it's a good reason for optimism, is the vaccine appears to offer the type of protection seen in natural infection. So that is encouraging. And Dr. Fauci is agreeing here, theoretically, the best vaccine you could possibly get is a natural infection. So the natural infection is the best thing you can get, but of course we prefer not to get sick. So this vaccine looks like it's being the next best thing because it triggers a similar immunological response. Moderna's candidate has millions of dollars backing from the Operation Warp Speed. So yeah, it's doing well, but there again, it's the best funded by far. So it's getting millions of dollars in backing from Operation Warp Speed, which of course is the operation launched by Central American government to try and get a vaccine by the end of 2020. I feel good about the projected timetable, Dr. Fauci said. Now, this means that he's optimistic there's going to be a vaccine by the end of 2020. Wow. Let's hope he's right. This is very optimistic, but hey, this is the leading expert in infectious diseases in the States. We are told. I think it's probably certainly fair to say he's the most experienced. What we're doing with vaccines, therapeutics and clinical trials is the real substance. Now, Dr. Fauci said this in response to criticism. A lot of people have criticised him, and he says, well, I don't really care about that because what we're doing with vaccines, therapeutics, clinical trials is the business. This is what we need to get us out of this. Now, just on the vaccine front, interesting, there's been hacking going on. Now, I can't get my own computer to work a lot of the time, never mind anyone else's, but hacking. Now, many news outlets, this one's from The Guardian, but many news outlets, James Brokenshaw, who's in charge of security issues in the UK, says, and for a senior politician to go public on this, these guys pick their words carefully. To go public on this means it's quite a big deal, this actually. More than 95% sure that Russian state-sponsored hackers targeted the UK, the US and Canadian organisations involved in developing a coronavirus vaccine. Now, as early as last month, I was getting reports that I couldn't substantiate from the US and Canada that this was the case. And for the cabinet minister to say he's more than 95% sure, he wouldn't have gone public unless he's got pretty good intelligence on that. So the question that was in my mind is, why is the Russian state, no, we'll come to that in a minute, why is the Russian state hacking our vaccine programs? What is the reason for this? And I don't really know why they would want to do that, because when the vaccine, as far as I know, the vaccine information is shared. So is it that these vaccination programs are competing with each other? So the question I want to ask is the information from Oxford, is the information from Imperial College London, is the information from Moderna all shared as they go along? And the fact that the Russians feel the need to break into systems and steal this information indicates to me that these different teams are not sharing their information as they go along. Because if all this information was shared in the public domain as they go along, then all the Russian intelligence services would need to do is log on to the internet and they will get the information. So it sounds to me, and I'm open to be corrected on this, but it sounds to me as if these different vaccine programs are not publishing their results as they go along. They're not giving out information. So is the Oxford group giving out information that would help the Imperial group? Is the Moderna group in the United States giving out information that would help the Oxford group? I would certainly hope so, but it looks like it's not the case. That there is not ongoing publication of data as they go along, because otherwise why would the Russians hack it? Because I'm assuming that the only reason the Russians want to hack it is to get the information to develop their own vaccine. I don't think they'd be wanting to hack it to destroy data or anything like that. And anyway, I'm sure all these programs have got the data very well backed up indeed. So what this implies to me is, yeah, it's concerning that the Russian state is hacking these programs. That's concerning. But what's actually more concerning to me is that they're not putting their data into the public domain as they go along. Therefore, that will be delaying the development of individual vaccines. In other words, this is a race. not a collaboration, not a cooperation. Oh, we got there first. Oh, Modena got there first. Oh, Oxford got there first. That's what seems to be happening. And to me, that is just terrible, because that means that the vaccine could be later than it would have been if we are collaborating. So people want to get there first, so they make lots of money out of it. I can't think of any other reason why they want to get there first. Prestige, Nobel Prize perhaps, but so that was concerning me, really. So yeah, pity that the Russians are hacking, but pity that they're hacking, but tragic that they need to, because this should be this should all be in the public domain, so it can all be shared as we go along, and it doesn't seem to be the case. So yeah, anyway, you get my point on that. Right, just to finish off, I meant to do this one earlier on in the last email. South Africa, and I just present this email for what it is. It's from a concerned citizen in South Africa. I know their name, of course, but we can't disclose it for obvious reasons. Thank you for what you do. Unfortunately, things are way worse here in South Africa than what your update could possibly convey. Now, if you watch the update on South Africa, it was, well, I assume it was a distressing video for you to watch. It was certainly, I had to sort of go into sort of professional self-controlled mode just to make it, because it was a very emotional video to make, as innocent people were suffering terribly through the corruption of the East Cape government and health authorities. So, worse here in South Africa than your update could possibly convey. You've only seen the situation in one hospital or province, but the same thing and worse is happening all over our beloved country. If this email is correct, this is seriously appalling news. Our corrupt government's solution to this horrible situation is to dig 1 million graves for mass burial. Only God can help us now. And ourselves, of course. So, the situation in South Africa does appear to be worse, if that were possible. Well, it's clearly possible than the distressing situation that I painted last week. Now, I've been in touch, or I'm getting in touch with a group of young independent filmmakers in South Africa. So I'm hoping to be able to share the linkage with the documentary material that they are currently making independently of government, independent of mainstream media, which clearly we have difficulty relying on at the moment. So I'm hoping to get that to you in the next week or two. Now, one last thing, and this is so simple, it's the idea of ventilation. I've been on about this for ages. The probability of getting this virus depends on the amount of viruses that you're exposed to, and probably if you're exposed to more viruses, you get a more serious infection. That appears to be the case. So obviously, if we can dilute the viral load with fresh air and breezes, then that's going to massively help. But this message of circulation of air and ventilation just doesn't seem to be quite getting through. Now, to illustrate that, this is a letter from a concerned citizen in London. I just wanted to bring something to your attention I believe is very important. I live in London, and since the barbershops opened, I observe almost all barbershops in London keep their doors closed when they have customers inside, and they let customers in without face coverings. Yesterday again, I noticed a small barbershop in a nice area, Kings Road, Chelsea. His doors are closed. Just open the doors. It's summertime. You know, we can have the doors open. No ventilation, 4 customers inside, cutting someone's hair. He had a face shield only, which is completely useless as the virus is too small and can enter from the sides. So he didn't seem to be wearing a mask. The customer concerned was elderly, therefore more at risk. Customers weren't wearing any face coverings. I think it would be useful if you could mention the importance of this. Absolutely. Absolutely. So simple. You know, it's summertime now in the UK. Open the doors, open the windows. Let's ventilate. Now, I'm just going to close with a video I got from. Where are we going? Second screen. There we go. So I got this video of a barber's in London. Now, I don't know if it was from the owner or not. It may well have been, but so we've got good information outside, which is good. Maybe you watched that video I made with Dr. Lindsay Campbell a couple of weeks ago, on preparation of work areas for the Vives. Now here we have perspex dividers between waiting areas, and of course this is going to be massively more effective if there's good ventilation. Massively more effective. I hope the doors are open as well, but good to see that these are compartmentalised areas, and I'm sure they're cleaned down with antiseptics, disinfectants between customers. Again, plenty of information. Now, taking patients' temperatures, I've no objection to that. Of course, it won't cover it, and but by the way, I'm not in for a cut here. I have no financial interest in this virus. Good hand sanitisers. But I've no objection to having my temperature taken going into a place, because if you've got an active infection, that should manifest itself with a fever, so that's worth knowing. Good cleanliness, good cleaning down of surfaces. I'm sure they're cleaned. Covers on the chairs, aprons for the customers. Physical separation. It goes without saying the barbers will be wearing masks. Not that we see that in this clip, but I certainly hope it's the case. So it just shows, you know, with a little bit of thought, you can, even with a relatively small premises like this, you know, you can have areas, and as long as you've got good, so if that back door's open and the front door's open, there's a good through draft, that's going to make all the difference. And I would be quite happy getting my hair cut here if I had any, compared to other places. So interesting. So that is us for now. I think I'll just show you some pictures of new friends from around the world. There we go. This is Fiona in Florida, and I think she's illustrating the importance of wearing masks. Fiona, I'm sorry, I don't know your dog's name. Anyway, what a clever dog wearing a mask. What a good dog. Anyway, I think Fiona illustrates the point very, very well. This is Hickik. I'm sure I pronounced your name wrong. I do apologise. Yeah, I've pronounced it wrong, I'm sure. But thank you for your email, and thank you for watching the videos. And I assume that's zinc, and I assume that's vitamin D. Okay, so thank you for that. Delighted you're watching in Israel, of course. This is Janice, who watches in London. So good to know you are watching in London, Janice. Thank you for the picture. This is Joanne in Wisconsin. And more news from Joanne next week, I think. Something interesting to come there. But I'm glad to see in the meantime that Joanne has got hand sanitizer, she's got vitamin D, she's got a mask, and hey ho, look at that. She's watching me on her phone in the garden. And a lovely garden it is, Joanne, too. So hopefully we'll talk again soon. This is John and Belma in Chicago. Now, I think this couple are chemical engineers. So I think they're kind of making a point here about from their chemical engineering expertise, which of course is a very good representative example of their levels of understanding. Thank you. Oh, now these are from Tonley Sap Clinic in Cambodia. So hopefully more from there soon. Now this is the lake. Tonle Sap is the big lake in Cambodia. It floods every wet season. Do get the right click. There we go. Yeah. So we see these ladies are wearing proper face coverings. This is the kromars, the typical Cambodian Khmer dress. Thank you, ladies. As I say, hopefully more from Tonle Sap clinic soon. This is a patient being seen in Tonle Sap. I have worked in some clinical places in Cambodia. I've been to Tonle Sap, but I haven't actually worked in this clinic. But we are hoping to get some more information from it soon. They seem to be doing very useful work there. So this nurse seems to be drawing up. Nurse or doctor seems to be drawing up some injection. Really good. Seems to be making the best use of the PPE at her disposal. Oh, here we have mask making from old clothes. Very good to see people using the resources they have available to help themselves as much as they can. And here we see mask making from an old t-shirt. So thank you for the people in Tonle Sap, and hopefully hear more from them soon.